We turn now to what some military officials call an enduring and pressing emergency, the rise in veteran suicides. A congressional subcommittee held a hearing today on military suicide prevention. On average, about 20 veterans die this way every day. Since 2017, at least 25 veterans have taken their lives on the grounds of VA facilities, 7 this year alone. Dean Reynolds has more on these heroes in crisis.
This is my favorite picture of us together.
When was this?
This was about 2 years before he died.
Alyssa Harrington's brother, Justin Miller, died by suicide in February of last year in the parking lot of this Veterans Administration hospital. A Marine veteran, he was 33. Gregory Miller is Justin's father.
You wanted to be in a military band.
Justin made the band, but the Marines saw he could make another contribution as a marksman in Iraq, manning a checkpoint with bomb-sniffing dogs.
The dog sat down, pulled the trigger. Those were his orders. And he said he did that for weeks, day in, day out.
When he left the Marines in 2007, his family says he had changed. While he still volunteered to play his trumpet at various occasions, he was increasingly depressed and even suicidal. Eventually, he sought help at a VA hospital.
We said we loved each other. I kissed him, and that was the last time I saw my son.
But after 3 days at the VA,
He went out to his car. He looked at his phone. He saw the text from my dad saying, "I love you, come home." And at some point, he took his own life.
experts in this field say veterans who kill themselves on VA grounds, and there were at least 4 just last month, are making a statement about their treatment. A federal investigation of Miller's death said the Minneapolis VA made multiple mistakes, from not scheduling a follow-up to overlooking his access to firearms.
They have people, but they're not trained the way they're supposed to be.
Some 6,000 veterans kill themselves every year.
We have, in the last year, had 240 interventions where we've actually stopped veterans from taking their lives.
Robert Wilkie is the VA secretary, whose department serves 9.5 million people. Since October, the VA has screened 900,000 veterans for mental health issues.
Of that 900,000, we culled it down to 3,000. 3,000 veterans that our medical professionals say might be at risk, and we are monitoring them.
What does that monitoring entail?
That means calls. That means visits, bringing them into our centers.
In Justin Miller's case, antidepressants came in the mail from the VA 2 days after he died.
And the worst part of his funeral was that they didn't have a live trumpet player. There was no one there to play for him.
The silent trumpet at his grave was a gift from his dad. Dean Reynolds, CBS News, St. Paul, Minnesota.